Technical Director of Epidemiology Dr. Avery Hinds says the COVID-19 death rate locally has stayed around the same figure in the past year.
The number of deaths, 375, over the total number of positives currently, which is 20,017, we get a case fatality rate of 1.8 something. And that has been really within the sort of the range that we have seen at the height of the previous peak.
As of Sunday, May 23rd, there were 206 deaths recorded for the month of May. Dr. Hinds says the increase in deaths is expected since COVID-19 infections continue to rise and reach more vulnerable people. Last Wednesday, PAHO Director Dr. Carissa Etienne pointed out that only 3% of people in Latin America and the Caribbean have been fully vaccinated against COVID-19 and noted that deaths have been doubling in several countries, including Haiti, the Bahamas, and Trinidad and Tobago. Dr. Hinds points out that isolation for COVID-19 positive patients at home is critical to avoid spread to other family members, especially those who may be most vulnerable. He says if everyone continues to take as much precautions as possible, there could be a decrease of COVID-19 infections 2 weeks from when the state of emergency was implemented. According to the epidemiologist, they had noticed a slight decrease from restrictions that were implemented on April 29th.
While we're still seeing an increase, or we're still seeing large numbers, we're not seeing that increase being as exponential as it had been. It didn't remain on that very exponential track that it was on in the last 2 weeks of April. And we attribute that to some extent to some of the reductions in mixing beginning to have the desired effect.
Dr. Hinds said as of 8 a.m. on Monday, total occupancy rates for COVID-19 patients at hospitals stood at 72%, with the ICU occupancy rate at 85%. Sunil Lalla, TTT News.